Hello and welcome. For those of you keeping a close eye on current events, especially for your UPSC preparation, thinking about mains, but also, what might pop up in prelims, we're diving into something really critical today.
Yeah, absolutely. We're talking about the heat waves in India. They seem to be getting more frequent and definitely more intense.
Exactly. And it's not just a vague future worry, is it? We saw severe heat waves hitting as early as March this year. That's much earlier than in 2024.
Right. It really brings home how urgent this is. We need to get a handle on what's actually happening.
And that's our mission for this deep dive. We've gone through a recent analysis in the Hindu, trying to pull out the core insights for you, because it's about so much more than just feeling hot.
Mhm.
Like, think about this, and this is maybe something to consider for your studies. Did you realize how much these heat waves impact not just health, but also India's economy and even social equity?
It's all interconnected. And the article really emphasizes this sense of escalation. This concern over the past couple of decades, seeing them start earlier, hit harder.
Yeah, it's a clear pattern.
And 2024 was the hottest year globally since we started keeping proper records, pre-industrial era records. So India is really at a critical point here.
Okay, so let's break it down. Starting with the most direct impact, our health. The Hindu piece points out something pretty fundamental.
Which is?
Well, as the air temperature gets closer to our body's average temp, around 37 Celsius, our bodies they struggle to cool down effectively.
That's the core physiological issue.
Yeah.
It's not just about feeling uncomfortable. When the body can't regulate its temperature, can't shed that heat, you get heat stress.
And that sounds serious.
It is. It means the body's core temperature is dangerously high. This can hit major organs, heart, kidneys, liver, the brain even. And in the worst scenarios, it can lead to severe illness or, tragically, death.
And it's not just the degrees Celsius on the weather report, is it? The article mentions humidity, wind speed.
Right, those are crucial modifiers. High humidity makes it harder for sweat to evaporate, which is our main cooling trick.
What?
And low wind means less heat is carried away from the body. So the same official temperature can feel and be much more dangerous depending on those other factors. Think about coastal versus inland areas, for example.
That makes sense. Different regions, different risks, even at the same temperature.
Exactly. Yeah. But moving beyond just the immediate health effects, the article digs into the socioeconomic side. And this is where, for policy analysis, it gets really important.
Right. This is key for the UPSC context, seeing those connections. The Hindu lays out some pretty profound consequences. Let's start with agriculture. Big one for India.
Huge. The heat directly impacts crop yields, sometimes leading to total crop failure. And livestock suffer and die too.
Oh, dear.
And you have to think about who bears the brunt of that. It's farmers, it's the rural poor, people whose entire livelihood depends on working outdoors, physically.
And the scale we're talking about. The article estimates around 75% of India's workforce. That's something like 380 million people.
Yeah, it's a massive number engaged in work that exposes them directly to extreme heat.
So thinking about employment, that obviously means lost workdays, lost income for millions.
Absolutely. And zoom out to the macro level, the economy as a whole. The Hindu mentions estimates, potential GDP losses between 3 and 5% just due to heat stress.
3 to 5%. Wow.
Yeah. And just in 2023, something like 6% of total work hours were lost because of the heat. These aren't small numbers. They're real drags on economic growth.
And this brings us to another critical angle for exams, social justice, equity. The burden isn't shared equally, is it?
No, not at all. The article really hammers this point home. Marginalized communities get hit hardest.
Like who specifically?
We're talking women, migrant workers, the elderly, people doing subsistence work. They're disproportionately vulnerable. For instance, think about gender norms.
How so?
Well, women often end up working in poorly ventilated kitchens, maybe wearing clothes that trap heat because of cultural norms. Their exposure is often higher and less visible, perhaps.
That's a really important point. And what about urban areas?
The physical layout matters. Urban slums, the way they're often built, can actually trap heat. So indoor conditions can become even worse than outside. It's a clear case of environmental factors magnifying social vulnerability.
Okay, so faced with all this, what's been the response? Policy-wise, the article suggests India was a bit late to recognizing heat as a major public health threat.
Relatively late, yes,
Yeah.
compared to, say, Europe. The Hindu notes that some European countries had heat action plans, or HAPs as they're called, back in the early 2000s.
Right. And India's first big step was Ahmedabad in 2013.
That's the one often cited as the pioneer, yes. Ahmedabad's HAP in 2013.
And since then?
Well, there's been quite a significant uptake. The article says over 140 cities and more than 23 states now have some form of HAP, so the recognition is definitely growing.
Okay, so for anyone studying policy frameworks, what do these HAPs typically involve? What are the main components based on the Hindu's analysis?
Generally, you see sort of 5 main pillars. First, early warning systems getting alerts out before a heat wave hits.
Makes sense. Second, public awareness. Telling people what the risks are, how to stay safe. Third is preparing the health system hospitals, clinics being ready for heat stroke cases, dehydration, etc.
Okay.
Fourth involves longer-term thinking. Strategies like urban greening, more trees, parks, and cool roofs. Using reflective materials to lower building temperatures.
Right. Mitigation.
And fifth, using data. Monitoring heat-related illnesses and deaths to see what's working and where the problems are.
That sounds pretty comprehensive on paper. But the article flags issues with implementation, right? Uneven, sometimes not fully effective.
That's a really crucial point. Implementation is patchy, and success seems to really depend on collaboration.
Collaboration between who?
Local government, public health folks, NGOs, community groups. When they work together effectively, the HAPs tend to be much more successful. Without that strong local buy-in and coordination, they often fall short.
So, building on that, what needs to change? Where do these plans need to improve to be genuinely effective and, importantly, inclusive, especially for those vulnerable groups we talked about? Well, a big one is making them much more localized and data-driven at that local level. Meaning doing detailed vulnerability assessments right down to the neighborhood level almost, looking not just at temperature but also humidity, which, as we said, varies a lot.
Okay, so context really matters. A plan for Delhi might need to be quite different from one for Chennai or Jaipur. Makes sense for a diverse country like India.
Exactly. And we need much better data, the article argues, on who is actually getting sick or dying from the heat. That detailed mortality and morbidity data is vital for targeting help where it's most needed.
The Hindu mentions the UK's alert system as maybe having useful elements. What's different there?
Their system is apparently quite sophisticated. It looks at both daytime and nighttime temperatures because not cooling down at night is a major stressor.
Oh, right.
And it provides quite detailed advice linked to different alert levels, like suggesting safer times for activities.
Yeah.
Tailoring something like that for India could be really beneficial.
And thinking longer term, beyond alerts, infrastructure, urban design. What's the role there, according to the article? This feels very relevant for sustainable development discussions.
Oh, it's critical for long-term resilience. We need building codes that mandate heat-resilient designs. Things like using reflective materials, ensuring good natural ventilation.
And public spaces?
Yeah, redesigning them too. More shade, definitely. More parks, green spaces, and just reliable access to drinking water fountains and things like that. Basic but essential.
The article raises a really tough point about informal workers. The advice to just stay indoors during peak heat,
Yeah.
it's just not realistic for millions, is it?
It's completely unrealistic for daily wage earners, construction workers, street vendors. Their livelihood depends on being out there.
So what's the alternative?
The piece suggests exploring things like direct financial support during extreme heat days when work isn't possible. And policies need to be really context-specific. A universal advisory might not work. You need different approaches for different groups and settings.
What about workplace adaptations and general public health measures?
Ensuring basic access to drinking water and ORS, oral rehydration salts, is fundamental. And where possible, employers should look at flexible work schedules, maybe shifting hours to cooler parts of the day, early morning or later evening.
And cooling infrastructure, any specific suggestions?
Yeah, scaling up things like summer shelters, similar to winter night shelters, but offering respite from the heat for outdoor workers or the homeless.
Okay.
And pushing harder on cool roof policies. Some states are doing it, but it needs to be much more widespread.
So if we try to pull all these threads together, what's the main takeaway from the Hindus analysis, the big picture way forward?
I think the core message is that investing in heat adaptation isn't just about saving lives, though it absolutely is.
Okay.
It's also economically smart. The costs of inaction are huge.
Right.
So we need a really holistic, long-term strategy. That means better coordination between different government departments, maybe looking at insurance for lost wages, and really embracing science-based innovation.
And keeping people at the center of it all, especially the most vulnerable, that ethical dimension you mentioned earlier.
Absolutely. It has to be people-centric. It must start by acknowledging who is carrying the heaviest burden and designing solutions that are fair, equitable, and sustainable.
Okay, so let's try and summarize this deep dive, especially for our UPSC listeners. Heat waves in India, a growing crisis, multifaceted, hitting health, economy, social equity. The early onset, the intensity. It demands urgent, smarter action.
And what's crucial to grasp, I think, is how interconnected these threads are. Climate change fuels a health crisis, which creates economic problems and deepens social divides. Understanding these links is key for policy analysis.
Definitely. As you reflect on this, maybe a thought to leave you with. Considering everything we've discussed, what role can individual awareness, community action play in actually building resilience on the ground? Something to ponder. And for all of you preparing for UPSC, keep these intersections in mind: environment, economy, social justice, governance. Heat waves are a perfect case study, touching on so many syllabus areas.
It really poses that fundamental question for India, doesn't it? How do you balance essential development with managing these escalating climate threats like heat waves? A complex challenge needing smart answers.
Well said. If you found this deep dive helpful for your preparation, if it sparked some thoughts, please do give us a like, subscribe for more, and definitely leave your comments or questions below. We really value hearing from you.
Yes, your feedback helps us tailor these discussions to what you need most.
This analysis was based on reporting from The Hindu. Thanks so much for joining us for this deep dive.
Thank you. We'll catch you on the next one.